So let's look at some of the bony landmarks in the lower leg. The easiest point to start is the tibial tuberosity, and then we know that on either side of that we have the tibial plateau. And then back to the tibial tuberosity, if we follow the shaft of the tibia, that sharp crest of the tibia, we can follow it all the way down towards the medial aspect of the ankle where we have the medial malleolus. On the lateral aspect of the leg, we have the fibula, and close to the knee we have the fibular head, and then through the soft tissue layers we can palpate the shaft all the way down to the ankle again, and then we have the lateral malleolus on the lateral aspect of the ankle. So these are the two longer bones of the lower leg. Then at the ankle, again, we have the medial and the lateral malleoli. Between the two of them, we have the talus. So talus fits into that U-shaped form created by the medial and the lateral malleoli. On the medial aspect, I'm going to turn the foot slightly. We have the navicular tuberosity, and then from there we have the shaft of the first metatarsal, and then the rest of the metatarsal form the forefoot all the way to the fifth metatarsal. Now the fifth metatarsal has a little tubercle on the lateral aspect of the foot. That's worth noting. And then it's angled slightly laterally as it goes towards the phalanges. So then these are the joints between the metatarsal and the phalanges in here. So a little bit higher up than we typically expect. And then the rest are the phalanges that form the toes and the two phalanges for the big toe. Going back to the ankle on the posterior aspect, I'm going to turn the foot this way. We have the calcaneus bone at the back. In front of the calcaneus bone we have the cuboid, and then that will join back to that fifth metatarsal that I already mentioned. In terms of vulnerable structures, I'm going to mark them on the skin so they're a little bit easier to see. We're going to go back to the knee. The best way to feel the popliteal artery is to have the knee flexed like I do here, and then using the fingertips kind of sinking into the soft tissue right in the middle of the popliteal space. And we know that we have the popliteal artery as well as the sciatic nerve coming from the thigh, where it splits into the common peroneal and the tibial nerves. The common peroneal will come on the lateral aspect and go around the head of the fibula, while the tibial nerve will stay deep into the calf and become superficial on the medial aspect of the ankle, just below the medial malleolus. In the same area with the tibial nerve, we're also going to have the tibial artery and vein. And then last pulse that we can, distally that we can feel, is typically felt between the first and the second metatarsal bones. And it's quite superficial and thin, and this would be the dorsalis pedis artery.